We're now joined by Dr. Vaidya, who is co-chief of the Division of Gynecologic Oncology and vice chair of the Department of Obstetrics and Gynecology at Hackensack Meridian Health. Good to see you, doctor.
Hello, good to see you too.
There's so much confusion, so much misinformation out there. Before we do the HPV, right, the whole vaccine issue regarding that virus, could you help us understand something as it relates to COVID vaccine and women and pregnancy, or the ability to be pregnant? What's the connection, if any?
There really is no connection. There's been a whole slew of rumors floating around, and unfortunately, these rumors have taken a life of their own. And I think building on fear and natural apprehension for something that's new, people have really fed into some of this. And there really is no scientific basis for some of these rumors that have started.
We need more accurate information like that. HPV stands for, the reason I'm saying it is because I'm not going to incorrectly pronounce this. Go ahead.
Human papilloma virus.
How common?
Extremely common. Up to 80% of individuals at some point or other have been exposed, I'm talking men and women, to this particular virus.
What do you mean men and women? I talk about misconceptions. I thought it was an issue that was disproportionately impacting women.
No, it actually isn't. HPV has been shown to be linked as a causative agent in a number of different cancers. And we know the most about HPV with regards to cervical cancer, where more than 90% of cervical cancers are driven by changes that are happening from HPV, this virus, on cells of the cervix. But we also know that over 60% of vulvar cancers, 75% of vaginal cancers, all also driven by HPV. Yes, those are organs that women have that men don't, but 90% of anal cancers, over 60% of penile cancers, and if we start looking at the head and neck, tonsillar cancers, cancers of the base of the tongue, cancers involving the oral cavity overall, these all have been shown to be linked and associated with HPV.
The vaccine, the HPV vaccine, who should get it and why?
So in 2006, the FDA approved the first HPV vaccine, which it targeted toward adolescent and young women. Okay. And so in 2006, Merck put out a vaccine that covered 4 different strains of the HPV virus. Shortly thereafter, in 2009, the FDA approved that male adolescents and all young adults, along with female adolescents as well, of course, should be receiving this vaccine. By 2014, Gardasil came out with what's called a nanovalent vaccine, which included the original first 4 strains put out by Merck, but 5 additional HPV high-risk strains. So that where we are right now is we are recommending this vaccination. Our target range is for young adolescents, boys and girls, ideally 10, 11, 12 years of age. The vaccine is approved from ages 9 up through age 45.
So hold on one second. We have a daughter turning 11.
Yes, she should be vaccinated.
She's a candidate?
Excellent candidate.
So to parents right now watching who are either hesitant or resistant regarding their children, you say what to them?
Well, the simple answer is this is an incredibly powerful vaccine, one of a kind in a way, that is able to prevent a large number of cancers that can affect both men and women. Get your kids vaccinated. We can spend some time and talk about some of the misconceptions. To start off, many people think that the vaccine has not been officially shown to prevent cervical cancer. And that misconception came about because some of the early studies on the vaccine looked at preventing precancer. But since the vaccine has been approved now for over 15 years, we have a tremendous amount of data that shows us that cervical cancer rates in vaccinated individuals have decreased. So for example, in the United States, nearly 30% reduction in cervical cancers identified in women under the age of 24. There's been about a 13% reduction in cervical cancers identified in women ages 25 to 34. And recently, just this past year in the New England Journal of Medicine, a really interesting study coming out of Sweden, where they've got long-term follow-up, showed an 88% reduction in cervical cancer in those individuals, those girls that were vaccinated under the age of 17. So we've got great information that counters this idea that the vaccine doesn't really prevent cervical cancer. It does. Another misconception, well, some people have said, well, why don't we just get pap smears? Pap smears are enough to prevent cervical cancer, aren't they? No, they're not. So pap smears, extremely wonderful screening tool, some limitations, but has really helped in our fight against cervical cancer. But pap smears identify cervical cancer. They don't prevent it. HPV vaccine tries to prevent it. In addition, pap smears don't identify any of the other anogenital cancers that we know are HPV driven. Nor do they identify any of the oropharyngeal or some of the head and neck cancers that we're seeing driven by HPV. So really, pap smears alone are not doing the trick.
One more, because there's a time issue. I want to be real quick on this. Let me ask you this. It's not a bigger question. It's a different question. HMH actually has a physician leadership academy that you well know I teach in. And one of the biggest areas we focus on is on the need for physician leaders to communicate more effectively. How important has effective communication become for you and your colleagues as physicians beyond simply clinical expertise, which is not a simple thing in itself?
Well, I've always thought that at least 50% of what we do as physicians involves communication, education, right? We're partnering with our patients. We want to try to help prevent disease. And the only way we can do that is if we can take the time and educate those patients that are coming to see us, whether it's parents, whether it's children, about the benefits of, we're having a whole conversation about HPV vaccine, but there are tremendous benefits to receiving good quality health care in ways that have made a difference for people's quality of life.
Next time you join us, let's talk about social determinants of health and a whole variety of other topics. Dr. Vaidya, I want to thank you so much for joining us.
Thank you so much for having me.
Stay with us. We'll be right back.
Think Tank with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by Bank of America, PSC&G, Horizon Blue Cross Blue Shield of New Jersey, the New Jersey Economic Development Authority, Choose New Jersey, the New Jersey Board of Public Utilities Clean Energy Program, the Fidelco Group, Johnson & Johnson, and by Caldwell University. Promotional support provided by New Jersey Globe and by New Jersey Monthly.
Hi, I'm Abby. You might see me as an ordinary person, but I've been living with a brain injury since 2018. Opportunity Project gave me hope, and I've gained confidence through job skill training and helping my family. Despite my challenges with memory, I see a possibility to keep improving.
If you have a brain injury, you don't have to face your road to recovery alone. Learn more about Opportunity Project and its partnership with Children's Specialized Hospital.